Okay, well, as promised, we are going to get started. So welcome everybody. Today is Thursday, October 8th, 2020, and just really delighted that everyone could join this panel and join this webinar, and we'll get into more details about that. Let me first introduce myself. My name is Scott Bruun. I am the Executive Director of the Chronic Disease Coalition, the CDC, or the other CDC as we like to call ourselves. We are the host of this event today. Just real quickly, for those of you who don't know who or what the CDC is, the Chronic Disease Coalition, we are a patients' rights, patient advocacy organization started about 5 years ago, and really our job is to fight against discrimination, disease and patient discrimination wherever we see that. And so most of our efforts are in the patient discrimination sort of things, and to assure that patients have the access that their providers and they need for their particular chronic disease. Let me start as well by thanking the attendees today. Really glad that you could join this webinar. We think it's a really important issue, a critically important issue, and there's been lots of people talking about this, and there will be a lot more people talking about this. But you know, in all the conversations going on the issue of COVID and chronic disease, there's probably more questions at this point than there are answers. And so we're going to try to solve a little bit of that, or at least address some of that. But I just want to thank the attendees for joining today and be able to participate with that. That is our job today. Our job is to address all, or at least many of the issues at the intersection between chronic disease and COVID-19, where we've been, where we are today, and where we are going tomorrow. And to do this, we have an absolutely outstanding panel of disease advocacy experts with many, many years of experience and diverse experience. And so I'm really happy and honored. Thank you to all of you, the panelists, to join this webinar today. I'll quickly introduce everybody, but then when we kind of get into the questions and interchange, I'll ask each of them to just kind of spend a moment talking a little bit more about what their job position is and their organization. But let me start with Laura Wingate. Laura Wingate is with the Crohn's and Colitis Foundation. Madonna McGuire-Smith, who's with the Pacific Northwest Bleeding Disorders Organization. Brittany Duffy-Gaucher with the National Psoriasis Foundation. Welcome, Brittany. Stephen Schultz with the Arthritis Foundation. And last but certainly not least is my longtime friend, Laura Keller from the American Diabetes Association. So welcome, Laura. So we've got two Lauras, not to confuse anybody. Well, here we are. We're at October 8th, 2020, and what a year it's been. What a crazy year. And I would just ask everybody to consider what they were doing, on October 8th, 2019. I, for one, had a girl starting her senior year in high school, and excited about what that great senior year was going to look like. And then I had a junior in college who was a cheerleader for one of the university teams, and my wife and I were going down to football games every weekend to see her, and anticipated that something similar would be happening this year, and of course that's not the case. What a crazy year, and I don't mean to make light of it, but I just know that everybody's, because of this disease and the economic ramifications, everybody's life has been, if not turned upside down, but at least altered significantly. In all seriousness, we know that COVID-19 has infected millions of Americans. It's changed every American's life, but I guess indirectly, and then directly has infected millions of Americans. And of course, the sad news is that we have had over 200,000 Americans that have lost their lives because of this horrible pandemic. We know, and this gets to the heart of it, we know that the virus is particularly harmful to seniors and those of us, and a few of us on the panel, that have chronic diseases, chronic immune system disorders. Further, we know that COVID-19 is even causing some of these chronic diseases or chronic illnesses with folks that catch it. We've seen, countless reports now about the tissue damage that goes with lungs and hearts, and creating heart and lung disease. We've heard the countless stories about kidney disease and even kidney failure resulting from the course of this disease, of this virus. We also know that the healthcare system has been turned on its ear, and to the great credit to the frontline providers, but the healthcare system has been turned on its ear, and everything we thought we knew a year ago, we don't know today. We know that people with chronic diseases are seeing their healthcare providers less than they should be. We know that people are delaying treatments. We know that there's delays in diagnosis and treatments for people who are acquiring chronic disease. So that's another factor that we have to think about. Bottom line, COVID-19 has absolutely had a disproportionate impact on people with chronic disease. And that's what we're getting to today. So again, we want to talk about kind of the current state, the future, the where we've been, where we are, and I guess most importantly, where we're going. As we roll out of the gates here, I've got a series of questions that I'll be, interchanging with the panel with, but I also want to encourage attendees, anytime that something pops to mind, Brian and with the Chronic Disease Coalition will be monitoring the chat box. So if you have a question, please don't wait till the end or anything like that. Do it now. As far as the run of show goes, I'm seeing it's about 11:08 Pacific, so 2:08 Eastern right now. We will go until roughly 11:45 Pacific and 2:45 Eastern, and then turn it over for questions, and specifically questions. So again, try to get this done under an hour, and we'll see how it goes. So, all right, well, let's get started. Panel, thank you so much. Let me start by this question. What has been, and this is a general question, but what has been the overall response of your organization? Kind of take the broad level, but the overall response of your organization to COVID-19. And Stephen, let's start with you on that in the Arthritis Foundation.
Yeah, Stephen Schultz. I'm the Director of State Legislative Affairs for the Arthritis Foundation, so we cover all 50 states and oversee kind of the state legislative portfolio for the organization. But kind of the broad spectrum of the organization, I think we think about broadly, arthritis in the Arthritis Foundation represents about 100 different types of arthritis. And there are so many different items within that. And so we've had to really kind of deep dive and see how each of these items is affected by COVID-19. I think just about every single one, but I think we put together a fantastic Care and Connect website that really helps provide patients, their caregivers, healthcare providers during this time the ability to go on, kind of see what resources they can dig into and dive into and learn more about on how to live currently with COVID-19. And then we have a tremendous helpline that if you have any questions or concerns, to call them if you're having insurance problems, if you're having issues. I think when you think of arthritis, you think about pain, but it's also kind of mental health too. I think we had a great response from a survey done previous to COVID-19, and it had 2/3 of our patients that had reported depression in the last 7 days before that survey, or 2/3 had kind of emotional distress or anxiety or fear 2/3 before that. So it's what pain causes, and that's built on between COVID-19. But I think we've also seen a lot of great deal of interaction between the federal and state legislators as a result of this, and keeping them updated on ways that their impact can help patients. And so from an organizational standpoint, it's been that kind of twofold as far as keeping our patients, our caregivers, healthcare providers updated on what they can do day to day, and then keep them updated on what we're doing legislatively and keeping them apprised of that.
Great. And just real quick, Stephen, have you seen, these new resources that the Arthritis Foundation has put in place? Are you seeing, is the arthritis community, I realize it's a broad community, it's not just arthritis, but are we seeing pretty good adaptation by the patient community within that space? How would you rate that?
Yeah, I think, like you said, pretty broad community. And then we also work, all the faces here today and the organizations, that's the great thing about the patient community, is that the issues that we work on are so universal that we're able to tackle them together. And so even though you may be an arthritis patient, there's likelihood that you have a comorbidity, that you may have diabetes, you may have Crohn's, you may have hemophilia. And so it brings these community together just because of that, but then also the issues that we work on. But I think there has been a great willingness to kind of really dig in and learn about what's out there. What can I do to solve this issue and make sure that I'm not alone? We have a great Connect group website and Connect groups that are in person when in situations where there's not COVID-19, but making sure that people feel like they're not tackling this by themselves, and that's important during this time.
Let me go to Laura Wingate, Crohn's and Colitis Foundation, and what Stephen was talking about, kind of the additional resources. I think with Arthritis Foundation, it's the new website links and resources and helplines. How about Crohn's and colitis? What have you seen during this this pandemic, and what has Crohn's and colitis done on kind of the patient help side of things, if that's the right way to put it?
Absolutely. I'm happy to share what we've done and what we're continuing to do. So Laura Wingate and Crohn's and Colitis Foundation, and my role is to oversee, I'm the Senior Vice President of Education, Support, and Advocacy for the foundation. So I think what I would add to Stephen, because we did a lot of the same things. We needed to focus on mental health, needed to ensure that people had a landing place for information. But I think how I would add value is in March, we came into 2020 with a plan. We were going to deliver certain programs and that were needed for our community. And then bam, we had to switch gears and immediately start addressing COVID-19. And I really am impressed by the agility of our foundation, but all the foundations out there, that we've been able to build information disease specific. So in my case, we built disease specific IBD information and iterated on that information as it changed. So, in March, we had one set of information from the CDC and our doctors. And then as we got into later April, we were getting new information. And now we have an even more rich information and data about COVID-19. And so we've been updating all of our treatment information, making sure our patients really understand what medications they can use. Staying on their medications is so important. What happens if they do contract SARS-CoV-2 and then actually get COVID-19, making sure that information's there. We were very supportive of a registry called the Secure IBD Registry that actually is an international registry that allows doctors to support to report, I should say, but also support their COVID-19 patients, so that we begin to understand the impact of COVID-19 on the entire IBD community and have the data to understand which treatments might be ones to be avoided. For instance, steroids, which I know were very helpful to President Trump. Well, steroids are actually, we have the data to support that they really should be avoided in most cases for patients with inflammatory bowel disease, and that the patients should talk to their doctor about reducing their time use of steroids during COVID-19. And so it's been a constant adaptation, a constant need to adapt our support programs. We did a wellness training where we did just a lunch and learn, where we brought on a psychologist to talk to our community and walk them through a simple breathing exercise. The thing that's interesting is we're not done yet. We're constantly having to continue to iterate and refine these resources as we learn more and as people adjust to the long-term implications of this pandemic.
Yeah. Well, Laura, and kind of the same question I asked Stephen. So have you, with all these efforts that Crohn's and Colitis Foundation is doing and will be probably even growing over the next while, how has the patient engagement been? I mean, are patients coming to you and engaging with you in ways that they haven't before? And let me, as an aside, that's a leading question, because what we're learning with Chronic Disease Coalition has learned through all of this is that in this changing healthcare world, the fact that we've got 50 state governments that are dealing with myriad problems, it's always been critically important for patients to be advocates, but it's never been more important than during this pandemic. What's the response? And I'll move on, but after this one, but what's the response that your Crohn's and colitis patients are? How quickly are they adapting to this?
Well, and I would say that I've never seen such an influx of users to our website. We had 1 million users to COVID-19 website pages in March, April, because that's when they were developed. So that was an extensive increase in utilization, and I've continued to see the constant need. And what we've been able to do, and I think to your question, is we want to then drive those patients, answer their questions about COVID-19, but then keep them engaged and informed about what's going on in their state. One of the big issues, and I know many on the call here are engaged with us on this, is step therapy, and helping to ensure that they're advocating with us around that legislation, or informed about the latest information on telemedicine and how they can leverage that and site of care legislation. So it goes beyond the need to just educate them. We want to engage the community, and I've seen a definite increase in our community engagement and the need for support services, like Stephen said.
Fantastic. Madonna, so similarly, how has this, I want to add a little element here, though, because I think it's important for the, we have, chronic disease is very diverse, right? I mean, arthritis, diabetes, Crohn's, IBD, psoriasis, I mean, very, very different diseases, and that's just a fraction of the world out there. So, Madonna, talk a little bit about what, kind of on the national hemophilia side, what's going on there, what you're saying. But then if you could a little bit, I understand I don't think any of us are medical doctors necessarily, but can you kind of get to a couple of the elements of COVID-19 that are particularly impactful to the bleeding disorder community? What should I know as somebody that doesn't have bleeding disorders about the impact of COVID-19 on that community?
Well, thank you very much. As you mentioned, I'm Madonna McGuire-Smith, and I have the privilege of being the Executive Director of Pacific Northwest Bleeding Disorders. We used to be known as Hemophilia Foundation of Oregon. We recently changed our name to be more inclusive because it isn't just hemophilia. Bleeding disorders are much broader than that. Actually, there's a much larger bleeding disorder community known as von Willebrand disease, and that is actually the disease that my family has. I have 3 children and a husband that all have VWD. But we took it a step further and we adopted a little boy from China that has hemophilia. So we get to experience both of those diseases, and during COVID, it's quite challenging. We also have done a lot of the same things that our colleagues in those organizations that have spoken already have talked about. We have all the resources. We've partnered with 2 national organizations, Hemophilia Foundation, or Hemophilia Federation of America, and the National Hemophilia Foundation. They're working on a lot of joint programs. There's a lot of resources available on both of their websites as well as ours. I think the greatest collaboration, though, has been with financial assistance. So the biggest impact in the bleeding disorder community is really continuation of care. So if you have hemophilia or von Willebrand's diagnosis, then you have to be on your game, and you have to treat, most of them treat prophylactically. And so if you lose your job and you lose your healthcare insurance, then you really don't have a way to continue those really expensive treatments. And if you don't continue them, then it leads to lots of other issues, especially arthritis and joint damage and just long-term bone issues and so many other things. It's an incredibly expensive disease. Most people with severe hemophilia will range between $500,000 and $1 million a year in care costs. And so if you do not treat, those costs go up significantly. You spend a lot more time in the hospital. If bleeds get out of control, then you have to have replaced joints. And there's such long-term issues that go with treatment that during COVID, the biggest concern for us is really access to care. And thankfully, OHSU and the Hemophilia Center there has been fantastic with their telemedicine visits. So they've done a lot of effort to reach out to all of those patients statewide and also throughout much of Washington. But the biggest thing is really connection. People don't have that device. They don't have that way to connect. So the partnership with the national organizations, the Hemophilia Center at OHSU and our organization, we've been able to actually get people electronic devices that will help them in their telemedicine visits, but it also helps them with their mental health visits. So we've been able to do some sort of co-visits that have helped with some of the challenges, chronic pain, all that kind of stuff. So they need that sort of mental health boost. So by getting them devices that keep them connected, it's really helped them to survive some of this. I do think there's going to be some more long-term issues. There's going to be a lot more layoffs. There's going to be, I'm afraid, there's going to be a lot more job loss. There's going to be people losing their housing, all of those kinds of things. And all of that goes with untreated disease could be incredibly detrimental to our community.
Thank you, Donna. And just for the benefit, because I know we've got kind of a national audience, so the benefit of everybody, OHSU stands for the Oregon Health Sciences University. Yeah. So
Thank you.
Yeah, right. Yeah, no worries. Brittany, let me go to you. Kind of the same question again. How's the National Psoriasis Foundation? What's been, if you will, the overall response to the organization? What have you seen from the patient community? Have you seen new or different engagement from the patient community? And then, if that weren't enough for you, are there things within the psoriasis community that are kind of unique as far as the impacts of this virus?
Great, thanks, Scott. So Brittany Duffy-Gaucher, State Government Relations Manager for the National Psoriasis Foundation. I oversee 22 of our states and do the legislative and regulatory work in those states. So with psoriatic disease, it impacts about 8 million individuals in the US. As many as 3.6 million people are undiagnosed or go, undertreated. So it's definitely one that, continues to develop out. I would say with COVID-19, the NPF has been very focused and very collaborative. We have really honed in on the evidence-based piece of it. I think our patients, very similar to many disease states on this call, it's one that comes with a slew of comorbidities. So folks have really looked to the NPF as the experts on how to treat, how to, access their provider. We've developed our arsenal and recommendations, when COVID-19 first began and it moved into a global pandemic, we have always kept our community up to date using scientific evidence. So first, our medical board released recommendations, and we can send this out with the video for all the links there, but our medical board released recommendations on how to treat, how to keep yourself healthy, very similar following the original CDC guidelines there. One thing I will plug that I think was really helpful in the beginning and continues to be a good resource is we have a podcast called Sound Bites that was a 3-part series that had rheumatologists and dermatologist experts that kind of discussed more at a molecular level what the disease does for psoriatic disease community. So I would definitely encourage folks watching this to watch that 3-part series because I think it was very informative. And then ultimately what we have done is create a COVID-19 task force. So this is led by dermatologist Joel M. Gelfand and rheumatologist Christopher Richlin. And it also includes it's very dynamic, I will say. So it includes not only rheumatologists and dermatologists, but also folks from the infectious disease community and critical care. So it's really looking at, now that we are, 6-7 months into this disease, kind of, like you said, what do we know now? And then what are we looking for the future? And then kind of making sure throughout that process, really looking holistically at how our disease is impacted by it. So we're really excited about that task force and the work that continues to be produced by them. The latest that they have done is released a 22 statements that they consensus voted on that essentially talks about how, kind of comments about psoriatic disease and COVID, treatment for it and recommendations that they have, as well as specifics around telemedicine. I think, I'm speaking from NPF. This is something we've really taken a leadership position in and really, worked with folks that have started the conversations around telemedicine and access. Like many folks have said, access to care is the biggest barrier. And so, very similar to Madonna saying, folks just needing to get in and continue treatment and keep on that regimen. Psoriatic disease is the same. So, we we on an advocacy level have really pushed for telemedicine, and will continue to push that into 2021. But also in those statements, they go over preventative measures of how to keep yourself and your family safe or loved ones. And then also kind of on the horizon, looking at what the vaccine will look like, you know, how that impacts an immune-mediated disease, and, you know, kind of long-term effects. And so I would say that's how we've tackled this, and continuing to keep our community, you know, updated and abreast about everything that's going on. In terms of an influx, I definitely think that, you know, once we kind of understood how this disease does what it does, very similar to what Laura said, is that we saw a huge increase of folks engaging, you know, on our website. We also have a patient navigation center that helps folks literally navigate the system. And so folks, you know, we saw the numbers that we hit in a month, we were hitting in a week. So definitely folks being engaged and looking to the NPF. But again, I really feel like we've done our due diligence to get the information out there and keep our folks updated.
And thank you, Brittany. Did you say that there's 3.6 million undiagnosed? Is that cases?
Yes. So either underdiagnosed,
Okay.
with treating or not. So it's one of those diseases that, especially looking at skin of color, if we start talking about racial and ethnic, you know, diversity, this is a disease that is oftentimes under diagnosed, and then also, you know, folks are being undertreated because the severity is not being taken to what it needs to be.
Well, and I guess the point for everything is exacerbated by the fact that people just aren't seeking the treatment, right? I mean, they're like, I'm going to wait because I'm not going into the clinic or the doctor's office. Laura Keller, let me kind of you know, talk about the American Diabetes Association and, you know, organizationally, what are kind of the big picture. But then I also want, if you would, you know, in the media, we hear an awful lot about, you know, the chronic disease community, and not to I guess, segregate against any other chronic disease, but diabetes and related conditions, hypertension and whatnot, tend to be the things that the media picks up on more than most. And then to take that a step further, in fact, Brittany just mentioned, you know, the ethnic and racial disparities. We tend to see this more with communities of color on the diabetes side as well. So that's a whole bunch to unpack, but just want to, you know, kind of open that line of conversation with you, Laura.
Absolutely great. So Laura Keller, I'm a Director of State Government Affairs with the American Diabetes Association. I have 9 states that I cover. I've been with the ADA for 21 years, and I'm a person living with type 1 diabetes for 21 years. So this is obviously something that's impacted me on a very high level as well. I think, you know, same as everybody else, we're working on telemedicine, we're working coalition, you know, with these other groups and those kinds of things. But I think, to your point, Scott, with people impacted by diabetes dying at a rate of 40%, the statistics are showing that, especially in communities of color, if you've got diabetes type 1 or type 2, you're at higher risk for severe complications. We're not at higher risk for getting COVID, but we do see a much higher risk of severe complications and death in a lot of people with diabetes. So I think that's why the media has come on. There's a couple things, though, that I want to highlight that I'm super proud of. One, due to the pandemic and highlighting those health inequities, our CEO, Tracy Bruun, was able to really push. We really pushed on the White House and Congress, and we were able to secure during the pandemic a $35 Medicaid or Medicare copay cap for people in the Part D plans for insulin. Because the other thing that's happening, as people have mentioned, people are losing their jobs, they've lost their health insurance. While we do work on insulin copay caps on the state level, and we've been able to successfully pass 13 of those now on the state level, seniors are also really impacted by this. And so that was huge. And I don't believe that would have happened as quick as it did without the pandemic. And that was an opportunity we were able to leverage. Tracy was able to be in the Rose Garden at that time. And, you know, she also represented people with diabetes well, because she was one of the few people who wore a mask and was really trying to model good health behavior. And the other things that we've done, besides we did the websites and we've got our technical stuff, we took our scientific sessions online. And so 15,000 people got the best, most current diabetes information along with COVID-19 from the healthcare professional side in June. We also took our diabetes camps that we do for kids and we made those virtual. And we were still able to provide a really cool experience. So that has definitely changed the way we deliver programs. And I'm really proud of that we were still able to give kids a fun experience and to do that. But I think for us, like overall, we are really proud of our health equity platform. So with our health equity platform, because we know communities of color are hit at a higher rate with diabetes severe complications and COVID severe complications, we have created in response our health equity bill of rights. We have 10 principles, and it's everything from, you know, health equity access to water, fresh drinking water. So we're engaging in advocacy in areas that we haven't taken the lead on before. So it's a really exciting time, I think, in health advocacy. So, you know, as much as this has been scary, working with our partners and doing things in terms of step therapy and all of these things, unfortunately, this pandemic has driven that data to prove that chronic disease is impacted negatively. And so I work very closely with everyone who's on this panel. They're amazing, and they represent not only their communities well, but all chronic disease well. And I think this is, even though budgets are going to be hard for states, right, moving forward, because unfortunately we have the data, we're going to be still making powerful statements and arguments for supporting healthcare for everyone, whether they have health insurance or they don't. So, you know, I hope people on this phone call understand that the chronic disease advocacy community is advocating on all cylinders right now, and it has led to a greater collaboration, but also the data is proving why. And so I think you're going to see some more great work happening, particularly on the state level in a lot of states in the next year.
Well, Laura, that's a great segue, because one of the questions I want to ask, I mean, and everybody has touched on this in some way in kind of the 30,000 foot global level, but what should, I mean, I'll get straight to the question. What should every legislator and every policymaker understand about your particular disease community, COVID-19? I mean, Laura, you hit it right on the head. All 50 states and the federal government, of course, federal government can borrow money, but every entity is going to be, looking at significantly less resources for the next few years, and probably significant increased demand for those resources over the next few years for a number of reasons, not just the chronic health and chronic condition side of things. So we talk often about, the absolute necessity for patients to get in front of legislators, to get in front of policymakers, to be making their case as constituents. What is it in your world? And I'll ask you this question, but what is it in your world that legislators simply have to understand as they move into next year and addressing these issues? Laura, let's start with Laura Wingate on this one, Crohn's and colitis. Sorry.
Yeah, no, it's fine. It really comes down to access, and we've all been saying it's about access, and, really legislators, and I'm going to take it beyond the state level. I'm going to take it all the way up to the federal level. They need to understand that, especially during these hard times, putting barriers in place that restrict a patient from getting access to a much needed treatment. In our case, it's often restricting access to the biologic and biosimilar drugs, that it puts a patient at jeopardy for disease complications, and it also puts them at jeopardy of surgery and life-altering events. And so we really need to eliminate policies like step therapy, and if we can't eliminate them, put appropriate guardrails on their usage, so that we can control costs, because we're all concerned about cost, but we can't let costs drive patients to not take their medicines or ration their medication, because ultimately the end result is going to be sicker patients in the long run and more cost to the healthcare system. And so I think we're focusing all of our efforts on creating access, whether that's site of care access, cost utilization practices such as step therapy. And again, I partner with so many people on this call that, I think you're going to hear similar answers from many of us, but we have to ensure people can get access to their providers and their medications.
I mean, Laura, that's a great point. I've always loved dealing with a legislator or a member of Congress, and there's not many like this, but you can kind of envision the green eye shade sort wearing that could care less about chronic disease. And again, there's not many of them like that. But even if they're doing their absolute fiduciary responsibility for taxpayers in a state or the country, if they are letting chronic disease slide, the cost on the back end is a heck of a lot more than treating it the way it should be on the front end. At least that's always the way I've always felt about it. Stephen, how about you? What kind of taking what Laura was saying, from a legislative advocacy committee, or not committee, but a legislative advocacy standpoint, looking forward, what is it that, at least from the Arthritis Foundation perspective, that you wish every legislator understood and acted upon moving forward?
Yeah, I think Laura said it well, and I kind of in my head was thinking about it. I think it comes down to not making things harder. Not making things harder for a patient to be able to get their medication, to access their medication, to see their doctor. And that goes to some of the things that people have said as far as utilization management practices, to telemedicine, we sent in a letter, partnered closely with American Diabetes Association and other groups on this panel, and other groups across the country signed on to it, as far as when there was kind of barriers for the USPS and the United States Postal Service, as far as making sure that with so many of our patients getting their medication through the mail, how important that is. It goes to even voting. We're working closely with some of the groups on this call with a letter to the National Governors Association and state officials, not making things harder for patients with chronic diseases who are, like Laura said very well, that if they do get COVID-19, then they're at a greater risk of issues as a result of that, and complications as a result of it. So standing in line for hours to vote, or not having access to be able to mail in their ballot or have someone else drop it off, or having drop-off locations. So, and that's very timely. So it goes down to that, as far as not making things harder. Make things a little bit easier. And sometimes, quite a number of those times, it's less costly, or like you said very well, Scott, that it may seem more expensive in the short term, but in the long term, it's only going to add cost to that brand or healthcare system.
Thank you, Stephen. Let me change the question just a little bit here. Let's start with Brittany on this one. COVID-19 has exposed long-term healthcare problems, significant problems in our healthcare system. Are these we've changed? Are these permanent changes? Will we go back to normal? What has it exposed? I mean, kind of in the, for you in the psoriasis space and this related diseases. I mean, what do we know about the healthcare system that we didn't know, and what needs to change or what has to change, Brittany?
Yeah, great question, Scott. I think, to me, this is the light at the end of the tunnel. I think for the Psoriasis Foundation and many of us on this call, those kind of broad access to care and the pitfalls of the current healthcare system, we have been highlighting for years. The ACA, I think, really helped a lot, but as many of us know, that is something that is currently under consideration. But ultimately, I think the talks of barriers to care, the talks about out-of-pocket costs, the talks about just getting your medication and to your provider, these are all conversations that many of us chronic disease patient groups have been talking about for years. And so I think the positive is that these conversations that we have kind of been beating the drum about are now in the limelight, are at the forefront. So I'm hoping that a lot of these changes that, are being done at an executive order or kind of short term will translate to long-term change. And I think a great example of that is telemedicine and telehealth. You know, I think that we've seen just across the board that, you know, they kind of open the floodgates for how to better access your provider. And I think a lot of those principles that we have been wanting for years, we're now seeing the legislators or regulatory folks take action and making those more permanent. I think too, in the same vein, many folks have discussed step therapy reform and utilization management reform. I think we're seeing that as well. And that's been a talking point that we have used and are hoping to see stick moving into 2021, is that, you know, patients can't wait. Patients can't, you know, they need their medications, they need to see their providers, they need their services. And so I think too, we're seeing that. And then ultimately the out-of-pocket conversation. I think, you know, like folks have said on here, people are losing their jobs, they're getting their hours cut back, wages are being cut back, you know, it's just unprecedented times. And so, you know, we need to make sure that healthcare costs are affordable, that people are able to access their medications, especially in the chronic disease space where, you know, for folks, this is either life-saving or, you know, quality of life saving. So, yeah, I think across the board, though, we've seen some short-term positives come out, but I think moving into 2021, especially at the state level, we will hopefully see a lot of those turn to more permanent solutions.
Okay, well, that's good to hear. So I want to move on to Madonna, but just real quick to the attendees, please feel free at any time to chat your questions in, and we'll integrate those. But Madonna, you know, Brittany mentioned, I don't think she's the word silver lining, you know, but kind of talking about what we've seen, you know, with the healthcare system, how the healthcare system adjusted, and some of the, you know, the positives that had come out of here, like a renewed emphasis and a renewed support for the concept of telehealth. What have you seen there, kind of in your disease area? And let's talk about silver linings. I mean, take a global view of what the positives that COVID-19 has created, if there are some.
So I can think of a couple silver linings. So excellent question, Scott, and well spoken, Brittany. I think the big thing for us is that we've had these advocates and we've been training them for years, and they're ready and they're poised and they're excited. And this is now their opportunity, because they feel like they, while they've told their story year after year, this time it really does make an impact. Access to care is vitally important. You lose your job, you lose your health care, what happens? So now all these people are well educated. We have a group of them across the state of Oregon, but also across the United States as well, ready to go at the state and federal level. So it's exciting that we have those people ready to go. There's an army of advocates ready to speak on behalf of all chronic disease to our legislators, and they're well educated. So that's a great silver lining. The other one in relation to telemedicine is I've talked to a lot of doctors, and they've all said, you know, we've been on the verge of telemedicine for years. Yeah. And this sort of, you know, caused us to go into a crash course, and it actually helped us to get beyond that planning stage and into implementation. So for our disease, the problem is that you need to see the joint, and you need to see sort of the internal bleeding. You need to know if it's continuing. So the really exciting thing is there's a lot of devices that you're going to be able to use on your computer. One of them being an ultrasound machine that you can put in by USB, and then the doctor be able to see on the screen your bleed in your joint. They also can do that with a way to do your heart rate as well, and your pulse. They can connect that to USB as well. And so I think a lot of those things, it's kind of sad, but in a way good, that we've been experiencing a situation that kind of projects us into the future and gives us that opportunity. So the distance in many of our states is huge, right? For Oregon, you can live up to 8 hours from the treatment center, which happens to be in Portland. And so now with this distance beyond COVID, we'll be able to continue that care, that telemedicine care that is developing now out of necessity, but will hopefully continue to be there beyond.
Oh yeah, and the whole concept of phones and watches and everything else and the apps that go with that. Let me kind of take the same question to the two Lauras. Let's start with Laura Keller. The silver linings of this in the diabetes community or the general healthcare community.
Yeah, I think, some of the silver linings were because we've gone to such a digital world, and we've gone digitally with our medical trainings and our town halls on updates around COVID and diabetes and our camps. We're able to access kids who didn't get to go to camp, who maybe lived 8 hours from the furthest one away. So we are getting to people who need our resources, and I'm sure the other groups are doing the same, right? Because everybody's also more accepting of virtual. So that's been a huge positive. I think for us as well, the fact that the data is unfortunately proving that if you have diabetes and you get COVID, you have much higher risk of death and of high extreme consequences of having that. So we've been able to show why prevention is so important, because that goes back to kind of access to care and what everybody else is talking about. Yes, we need telemedicine, and I've done a telemedicine appointment as a person with type 1 diabetes during COVID, and it was great. It was fantastic. I uploaded my information. It went really well, but it's also shown us those health inequities that we have in America in a way that people have always talked about, kind of like Brittany saying, we've talked about these things for a long time, but now we really have the information and the data and the public awareness, not just with legislatures, but the public as a whole, that we have some serious gaps we need to work on. And so I think from a diabetes perspective, it's really highlighted why prevention of obesity and prediabetes is so important, because we can prevent people from getting those things if they have access to healthy foods and fresh drinking water and education and all of those things, right? So for me, it's an exciting time to be in health advocacy. So that's the other piece. Just like Madonna was saying, our advocates are excited, they're charged up, they're trained. There's people who are new to the associations, I'm sure, for all of us who are now getting engaged in terms of wanting to advocate for people with chronic disease. So I'm hopeful that all of this and everything we're going through is going to lead to a healthier population in the United States.
Yeah, I mean that's a great hope, and obviously it's a factor of education. It's a factor of patient mobilization. It's a factor of that question we had earlier about making sure legislators and policymakers and thought leaders understand that. I think that's fantastic, Laura. Laura Wingate, Laura Keller mentioned, not only what the silver linings within this large mountain of COVID. So of course, we don't want to lose sight of that, but the real silver linings there, as well as kind of her organization's ability to adapt and overcome when it comes to patient engagement, patient events, fundraising events, walks, bike rides, all those sorts of things. And you mentioned it too, you kind of alluded to that earlier when you were talking about Crohn's and Colitis Foundation. How about from your perspective? I mean, I think a lot of things have probably been said, silver linings, but anything new to add in kind of that category of thinking?
Yeah, I'll take collaboration. So I think collaboration has increased exponentially due to COVID-19. The foundation's always collaborated in the education space, but I've seen barriers to data sharing that there may have been walls up in the academic world previously. Now you see so many registries being set up by different disease states, the one I mentioned, Secure IBD, that is allowing doctors to share data so that we can better understand population health and get to outcomes more quickly. And I think that's a positive outcome. And I think the emphasis on real world evidence and being able to use that evidence is also another positive outcome. And then I'm just going to piggyback on Laura, because I think it's so important, the agility that not-for-profits have had to use in adapting their events, their camps, all of their education. I think that's something that's here to stay. I've been in not-for-profit management for a long time, let's just say. And not-for-profits, we've always been really good at innovating in a sustaining way, but I wouldn't say we were the most agile, like leveraging the techniques of the startups and putting something out there, testing it quickly, and then moving on. I think COVID has really challenged us in a positive way to try things, be okay with letting things fail, and then dusting ourselves off and doing it again until we get it right. And I think that's another positive outcome of this pandemic.
Thank you, Laura. So we've got a couple questions I want to integrate here, and I'm looking at them right now. The first one I'll start with is from Sarah LaRocca. She asks, are there any groups focusing on employee protections to help chronic illness patients keep their jobs in the first place? And then she goes on to talk about, just all the challenges with jobs and the ADA. But let me just keep it at that first thing. What are we seeing in kind of the, advocacy for chronic disease workers and how that, are we seeing increased instances of discrimination? What are we seeing right now?
I'd love to jump in on that one, Scott.
Please, go ahead. Yeah.
The American Diabetes Association has a legal advocacy department. And as soon as COVID, the pandemic hit, and we were seeing lockdowns in states, our legal advocacy team set up resources, and we were getting thousands of calls a week from people who had lost their jobs or were worried about their protections. And so we set up COVID-19 and employee and your rights information. It's on our website, diabetes.org. You can find it. We also set up for kids in schools. And so we have a whole protocol and information for kids in schools. And so I think all of us, to Laura's point, have been very much more nimble and quicker about that. But that was a huge focus for us the first couple months, was how do we help people keep their jobs or ask for the right accommodations and protection so that they can be safe at work. So that is definitely something that was on a lot of people's minds. We get a lot of phone calls about that every day still. And our information is on our website. I would imagine it is for everybody else too. But that is something that we've spent a lot of time and resources on. Also engaging in terms of participating and supporting some actions around litigation where needed, as well as in the voting space to make sure people have their rights in that area as well.
Yeah, and Laura, that's outstanding. And when I mentioned, and just to clarify, when I said ADA, Laura knows this. I meant Americans with Disabilities Act.
Yes, absolutely.
And so, with that as a background too, is that not that necessarily any of us are experts in the line by line detail of the American Disabilities Act, but does it afford adequate protections during this unprecedented time? Somebody else want to jump in on that one? Stephen, how about the Arthritis Foundation? I mean, are we seeing, or I should ask, are you seeing increased incidences of potential workplace discrimination for arthritis patients, or even non-accommodation or those sorts of issues?
Yeah, it's something that I think very similar to Laura, as far as I think it's important that when kind of making that connection with our patients, as far as kind of making sure that they know that they have the resources that we provide, our helpline. So if they're having particular issues, I remember seeing some come through as far as that goes, in making sure that we can work with them and provide them with kind of any particular resources that can provide them with their specific situation or their state, and make sure that we can kind of fight for them and advocate for them, and kind of relay that information back to elected officials so that that they know that these are issues. And so if there are abilities to supplement that, whether in current or future relief packages, to ensure that people continue to have those resources, have funding, to be able to know if there's situations where I have to stay home, I'm not able to go and do this job, but my employers are requiring me to do so, that they have that ability to contact us and other coalition partners, in making sure that they know that they have those resources and those people fighting for them and wanting to hear those stories, because hearing those types of stories allow us to be able to make kind of affirmative action to help them and help people like them.
Laura Wingate, I know that workplace accommodations are particularly important to the Crohn's and Colitis, IBD network. Any new situations that have arisen with this? I mean, you know where I'm going.
So I do think the ADA is intended the right way to support those, reasonable accommodations. But I think what we've seen is for the Crohn's and colitis community is as businesses opened up, in states where we have restroom access laws, so laws that protect patients to be able to use a restroom that may be an employee-only restroom, as states have opened up their businesses, the restroom access laws haven't necessarily applied. And so people are still being denied access. And not that Crohn's and ulcerative colitis are just diseases that require the use of, they're very complex diseases, but this is something that, it's a very difficult topic because we have a pandemic. We want to protect people, but we still need to protect the rights of people to use bathrooms, especially in emergent situations. So that's something that we're working on right now to help address, especially in those states where the law has passed, and ensure those patients have protections, as well as protecting the accommodations and all the ADA issues that we've talked about.
Well, thank you, Laura. Another question, just real quick, I want to throw out there for one or two people to comment on as if you would like to. And the question is from James Atkins, and he asks, what do chronic disease patients need to be aware of as we get closer to a widely distributable vaccine? And he further asks, where should chronic disease patients look to find the information, the best sort of information on that? Anybody want to take a stab at that one? Yeah, Madonna, please.
So I'll just make a brief statement. So I'm hoping that they're going to go to their national organizations or speak to their healthcare providers, because that's what we always encourage. Talk to your healthcare provider for your healthcare needs. I know for our bigger concern is that intramuscular shots cause bleeds, and bleeds can lead to lots of other things, issues down the road. So we're concerned that it's just going to come out in a shot form, and that it's not going to be an option in any other. So like you can get the flu in a mist and you can avoid the intramuscular bleed. When it comes to the vaccine for this, we're just really concerned that it's only going to come out in a shot form, and then we're not really sure how our patients will get that.
That's interesting. I hadn't even thought of that perspective, Madonna. Anybody else?
This is Brittany. Just to piggyback off of what Madonna said, I think the fact that this vaccine will be impacting the immune system, with psoriatic disease being an immune-mediated disease, I think, like Madonna said, you need to be talking to your provider and really looking for the experts in this field. I know, one of to piggyback off the I'll use the steroids, for instance, that's been seen as a treatment for COVID-19. And we have encouraged our patient community to not take those steroids because it controls inflammation, but that also means that it plays into the overall immune system. So that could impact your treatment plan, especially if you're on a biologic or biosimilar. There could be some sort of adverse reaction. There could be, your biologic then doesn't work. So there's like a whole slew of issues that could arise. So I think for us specifically, that's why our COVID-19 task force is really monitoring this progression of what the vaccine will be, how it impacts the immune system, and then ultimately how it could impact, our disease, right, our patients, because of the nature of this disease and our disease. So just echoing other folks, I again, please talk to your providers, and then, we will be getting out information as soon as we know.
Yeah, never been more important for those of us with chronic diseases to be in constant communication and collaboration with our providers on all levels. Well, hey, we are quickly approaching kind of the end of our time. None of you are candidates. I don't think any of you are political candidates. I'm not aware of you are. But we're going to do something they do in kind of political settings, and just do a quick round robin, just to give your last food for thought, just a few seconds from each of you. I always put Laura Keller on the spot, so I'm going to start with Laura. But just any kind of parting thoughts, Laura?
Yeah, I think just keep checking back to all of our websites and the data, and know that we're putting science behind our recommendations. So we're following the CDC recommendations, but all of us have scientific medical volunteers, experts in these fields, and we're putting data and science behind our recommendations. So I want you to be confident in the information you're getting from all of us as chronic disease, and then ask you to engage. We need more voices to engage with your legislators, both on the state and the federal level.
Thank you, Laura. Brett or Madonna?
Sure, just reach out, like Laura just said, reach out to your organization, whatever, if it's local or national. Stay in touch with them because they're going to have the most up-to-date information. But also, if you haven't reached out to them before, this is a time to find out more about what your role could be, how you could get more active, especially during this time of trying to get the vote out. Definitely, look at your candidates carefully, know what they stand for, ask them questions, be a good informed consumer, but do it through the eyes of your organizations because they're going to be the ones that have the most up-to-date information on all kinds of treatments and care.
Great, thank you, Madonna. Stephen?
Yeah, I think twofold. First, due to COVID, I think we've really centered around the idea that putting practice into preach that we want to be a volunteer-driven organization. So we need volunteers like you and friends and family that that have arthritis to be those volunteers that drive the organization. And then secondly, I think Laura said, well, that this is a perfect time to engage with your elected officials. I think right now you may think they're not meeting. I can't go to the Capitol in person. I can't go to their office in person and meet with them. As we get back into session, as we get into things, and even though there's COVID and it may be a lot of their elements are virtual, I think a lot of these elected officials are adapting to the virtual environment they are. I've seen so many of our advocates engage so well with their elected officials via Zoom, via so many different virtual elements, and they're so willing to do so. I think most of their days outside their elective official duty is to meet with constituents, to meet with patient advocates like yourself, and they don't have that ability to meet with you in person, so they're willing to do so virtually. So take advantage of that.
Yeah, no, that's well said, Stephen. Brittany?
Yeah, thank you, Scott. So our motto right now at the NPF is to lean in. And I think, I would encourage that if anyone watching this or wanting to get more information, lean in. I think we are living in, like you said, unprecedented times. And so, I think we need to make sure that we are being engaged with our organizations. We're both, going to events and engaging with other, folks in the community, because I know right now it can be very isolating. So, please check out, I know the NPF has a slew of virtual events that you can join and have some of that engagement with other folks. Be engaged when it comes to, politics and being an advocate, vote, get involved with your organization and have your voice heard. I know many folks have said today, now more than ever, your voice and your experience with your disease needs to be heard. So please reach out and get plugged in that way. And then, again, it's a scary time right now, but continue to engage with your provider and get your treatment. If you are having barriers to care, many of our organizations have some sort of patient navigation or, resources for that. Like I said, we'll make sure to send out the NPF's Patient Navigation Center link to engage, but continue to get treatment and continue to take care of yourself.
Excellent. Thank you, Brittany. And last but not least, Laura from Crohn's and Colitis.
My colleagues have really said it very well. Stay engaged, be an advocate for yourself, be an advocate for the whole country, and vote. And I'm going to add one thing: if you can, and they have the ability to support your disease foundations, help us out. We want to be here for you, but we only exist with support. So if you are in a position that you can not only tell your story, use our resources, but also donate. It's so important to all chronic disease organizations to support their efforts during this time as well.
Yeah, very, very well said, Laura. Yeah, everybody, please. The time has never been more important to support the groups doing the good work. Well, let me wrap this up. I first of all want to say thank you so much to this august group panel. It's just been a real delight and an honor. I mean, seriously, a very heartfelt thank you to each of you for carving time out of your days regardless of what part of the country you're in, to be able to join and participate in this very important conversation. I learned things and had things that went through my mind that I hadn't even thought of before. So that's exactly what this is about. So thank you all so much. And thank you to our attendees. This is one that people are watching live, but then also has been recorded and will be used in many other platforms to kind of discuss these issues. So thank you to everybody that's able to view. And then let me just say on behalf of myself and the Chronic Disease Coalition, thank you everybody for participating. Please take care of yourself. Please protect yourself. If you have chronic disease, you are particularly vulnerable in a number of areas. I do, several of us do, one of my children does, and so it's never been more important to take care of yourself, to be in conversations and communications with your providers across the board. And then as everybody has said today, and Brittany, you said it great, lean in. It's an incredible time in our country, in our world. We're the front lines of this. We're the epicenter of the impact of COVID and this disease or this virus, not only right now, but what it looks like in the healthcare system going forward. So I think, Brittany, you had the greatest, last line, if you will. I would just encourage everybody to lean in. Let's roll up our sleeves and get this done. And with that, I bid everybody adieu and thank you so much. Have a great afternoon, everybody. And we'll, again, thank you. And we'll see you on the flip side. Bye now.